woman. She's somebody who knows a lot about the lungs, and she's an expert on the topic we're going to be talking about today. She's Dr. Uchechukwu Agboje. She's a fellow of the West African College of Physicians, specializing in respiratory medicine. So let's give it up for her. Yay! And if you're new to this channel, this is Chilling with the Doctors. Here we share you amazing tips that will greatly improve your physical and your mental health, and especially making this information tailored to those of us who live in countries where we have poor access to healthcare and we have to pay out of pocket. So it means we have to be a lot wiser to save a lot of money. So today we'll be talking about a very popular topic. We're going to be talking about asthma. Asthma is common in our environment. A lot of people have been diagnosed with asthma. Asthma can kill, so this is one of the reasons why we need to talk about it so we are more informed. My people perish for lack of knowledge. The more you know, the more you live.
For us to notice that it's a disease of the respiratory system. When we talk about the respiratory system, we are talking about the system in the body that helps us take in oxygen, utilize the oxygen properly, and then give out carbon dioxide, which is like the waste product. So what happens in asthma is some people inherit a condition in which their airways or their respiratory system has some form of hypersensitivity. By that I mean that people who have asthma are sensitive to common things in the environment which other people are not sensitive to. So when they get exposed to these things in the environment, usually when they inhale them, they begin to have these symptoms of asthma. It's something that people are born with. It's not spiritual, like many of us will say. And if you notice, it runs in families. So that really tells you that it's in the blood, or it's something that people are born with. So that's in a nutshell, that's what asthma is. So the most important thing is that these people have the genes. Some people have the genes, but they don't express it in their lives at any time. So, but some people have said that exposure to some of these things in the prolonged exposure to these things in the environment. So I'll give you some examples. For instance, some people notice that whenever they are exposed to dust, so prolonged exposure to these things can make the genetic thing that they have begin to manifest. And then some people have also said that there are some drugs that people can take. I don't want to mention them, but there are some drugs as well that can make people have asthma. Those are the common things.
Or they went to maybe a chemist and they said it was pneumonia. And I know that the treatment is quite different. So how would you differentiate between asthma and pneumonia?
And so a professional will be able to examine you and tell you the difference. But some important things that I would like you to know is that asthma is something that we'll say is treatable, but it's not curable. So it comes and goes and comes and goes. And then the person who has asthma will notice the triggers. The person who has asthma will notice that there are some drugs that he takes that makes it to subside. Okay, the person will also notice that there are some times of the day that the symptoms are worse. Unlike pneumonia is essentially an infection, so it's caused by an organism. Okay, we talk about bacteria, we talk about viruses, fungi, and all those things. But the treatment for pneumonia is once and for all. It doesn't come and go and come and go, except people who have some other underlying problems. Okay, but for pneumonia, they are usually very sick. It's a short duration. They are treated and it goes completely. It's not something that keeps coming and going and coming. So that's basically the difference that we should do.
Someone who, in other words, somebody that has asthma may notice that they are having those symptoms, the difficulty in breathing, the cough.
Yes.
And they may notice what really caused it.
Of course.
So let me ask, is it true that when somebody lies down on the floor, on a cold floor, the person is going to come down with pneumonia?
No, it's not true.
Okay.
It's not true. Cold, or some people even say when they play in the rain or when they take their bath with cold water or when they drink cold water, it can cause pneumonia. It's a myth. It's not true.
So it also tells us that when somebody is maybe having those symptoms when they are exposed to cold, it's more likely that they are allergic to the cold, not that they are having pneumonia.
Yes.
Because like you said, pneumonia is an infection. It's caused by germs.
Yes.
All right. So for those of our viewers now who already know that they have asthma, when they have an acute attack, when they have that difficulty in breathing, the cough, the wheezing, what is the right thing for them to do?
Okay, very good. So for someone who has been diagnosed with asthma by a proper medical professional, there is an inhaler that you have been given, or there are some drugs that you have been given. There are two types of drugs, okay? There are some that you are given to help reduce the number of attacks you will have, or even not allow you have attacks at all. And there's another one that you are given for emergencies or for acute attacks. When you have the attack, you should use your inhaler. You should use that inhaler. Now, we usually will say if you use the inhaler twice and you don't feel any relief, you should go to a hospital. It's not advisable that you should stay at home inhaling rub or somewhat of those other things. If you are a known asthmatic patient, you know the inhalers that you use. I don't want to mention the names of the drugs here for obvious reasons, but you should see a medical professional. They will give you some drugs or some inhalers that will help you. When you have an acute attack, take your drugs. If you take your drugs or use your inhalers and you don't feel better, go to a hospital so that you can be properly seen and taken care of.
What we've been able to establish today, that asthma is not curable. Yes. So when you've been diagnosed, your doctor is going to give you drugs, including inhalers, that you will go home with. And then when you have the acute attacks, you should use those inhalers first. If it doesn't work, then you should see a healthcare provider. Now, I find that, and I like as you said, that the rub, the inhaling mentholatum, for instance, wouldn't work, because I've been somewhere before and said, can't you just prescribe a first aid? Can't the person just put hot water, inhale hot water and get better? But really, those don't work.
They don't.
Okay. What about those tablets? Because there are some people that use the tablets whenever they have attacks. They take the tablets. There's this particular one. Those of you that have asthma, you know there's one that makes your heart to start beating, start pounding. Shouldn't they use those when they have acute attacks?
Advise them to use those tablets, because it's true that some people use them and they get relief, but there are side effects to these drugs, and it's because of the side effects that we now discourage some people. Because of the asthmatic attack, they have overdosed on those drugs, and then they have had worse outcomes because of the effect of the drugs. As a matter of fact, some studies have begun to show that some people who died of asthma died as a result of overdose of the drugs they took to relieve the symptoms. So no, don't take tablets. Use inhalers. Inhalers are better. We say inhalers are better because the amount of the drug that gets into the bloodstream when you use inhaler is just small. Many of the drugs we use to relieve asthma have negative effect on the heart. They can cause the heart to begin to beat on irregularly and all that. So because we want to avoid this negative effect, we say just use the inhalers. If the inhalers don't control you, then come to the hospital.
Asthma for years, you may have been given tablets by medical professionals those days, but current teaching is avoid using those tablets except they've been given to you in the hospital. Yes. You should use your inhaler first. Many people are afraid of using inhalers because you may get stigmatized when people open your bag and they see the inhaler inside. In fact, one of my children is asthmatic, and when the class teacher saw me put the inhaler in his bag, I was like, other children will start being afraid of him. And I said, no, that is the best thing to do. So what would you advise somebody who feels ashamed carrying his drugs around? Maybe you're going for youth service, you're going to work, you're going to school, and then you have this in your bag. How do you handle that?
Yes. I've had several patients who have these issues. But first of all, I'd like you to know that it's not your fault that you have been diagnosed with asthma. It's not because of anything you did or something you didn't do. It just happened that it came to you. Do you understand? So you shouldn't worry about what other people think. You should be more concerned about your health and about how you can keep yourself healthy. What other people think is really makes no difference to you, and that's the truth. So even if people want to stigmatize you, it will not mean anything. It will not mean anything until you take it personal. So ignore what people are going to say, ignore what people are going to think. Be more interested in your health. Be more interested in staying healthy and staying sound.
We asthma carry their inhalers around.
Yes.
With them.
Everybody that has been diagnosed with asthma should have an inhaler in your handbag if you're a woman, in your pocket or in your car, somewhere that is close by, wherever you go. Some people are even advised for women that have many handbags, put one in each of your handbags. For people that have cars, let there be one inhaler in your car at all times, because you really can't tell where you would go and you will be exposed to these things in the air and you start having attacks, start coughing, and start feeling the symptoms. It's more embarrassing if you start having symptoms in a public place than if you have to use your inhaler in a public place. So rather than having symptoms outside, use the inhaler outside and prevent the attack. When you have the attack, people now start feeling sorry for you and people start doing all that, and which is what people don't want. So it's better to have an inhaler with you everywhere you are. Now, if we look again at the reason why people have asthma, we said people are born with it. It's in their genes or their inheritance. They are something they inherit. So if it's there, it's there. There isn't much you can do. But what you can do now is to control the number of times you have attacks and the severity of the attacks. Okay, so the first thing we advise people who have asthma is to study their environment, study those things that make them have attacks. We call them triggers. So you must determine your triggers, and these triggers are different for everybody. To some people, it's exercise. When they exercise, they find that they have attacks. To other people, it's soap or perfume, or some people it's just cold, and some people it's anxiety or excitement, just emotions. So study your triggers and then avoid these triggers. That's the first thing. Now, in a situation where you cannot avoid the triggers, for instance, you are excited, you have good news, well, you can't avoid being excited, no? So have your inhalers at hand. Adhere to the medication that you have been given. Use your inhalers as the way it has been prescribed for you. Yeah.
Okay. That's very good to hear. So this also means that if you have a friend, a sibling, a husband, a wife with asthma, you should always encourage them, always ask them, where is your inhaler? They are going somewhere, they are traveling, they are going for a wedding. You can always ask them, where is your inhaler? That doesn't mean the person is sickly, because I remember when I was in school then, we used to look at, I went to a boarding school, we used to look at those people that have asthma as being very fragile. Is it true?
No, it's not true. It's not true. People who have asthma are just regular people. They are everyday people. Some of them are the strongest people you could ever meet, you know. Yeah. They just have allergies to things that we don't have allergies to. That doesn't mean that they are fragile. That doesn't mean they can't do what other people can do.
Is it advisable? You know, like now, for instance, when we come to genotype, they'll tell you AS, don't marry AS. So if there is no history of asthma in my family now, and I have you're dating somebody that has asthma, is it advisable to marry them?
Of course. Of course, asthma is not it's not transferred the way sickle cell disease is transferred. The risk of a person having asthma transmitting it or to their child is much less than that for sickle cell or for all the others. There are people who have, there are other medical conditions, of course. There are people who have hypertension, there are people who have diabetes. We don't ask about, should I marry somebody whose father had diabetes or all of that, because we know that these things can be controlled. We know that these things are not they're not beyond our control. So yes, if you have somebody who you love and has asthma and you want to marry, please go ahead. There's no problem. There's nothing that says that any of your children will have asthma. Yeah.
So that means if you're dating someone that is asthmatic, you can go ahead and marry the person. There's no need to fear. Especially if the person is well controlled.
Yes.
The person will live a normal life. Do people get asthma in old age?
This is a very interesting question. And I've learned, yes, that recently, that asthma can actually start at any age. Okay. Yeah. For some people, or for most people, the generality of people, the asthma starts in childhood for most people, and some people even outgrow it. By the time they are old, they have outgrown it. Okay, but some other people, they have these tendencies while they are young, and as they grow older, some of them in their 50s, some of them in their 60s, that's when their own asthma starts to manifest.
So a mother asked me the other day that should she get a nebulizer for her child? What would you say?
I would say yes.
Okay.
I would say yes, especially for children, you know. Okay, one thing we'll notice about asthma, people who have asthma will know that their symptoms are usually worse at night. Okay, and like I've been saying and saying, if you don't do well on your inhalers, go to the hospital. The way Nigeria is, there's a lot of insecurity. I won't advise you to open the doors of your house at night and be going to the hospital, except you live in a very secure place. Okay, but if you can afford a nebulizer, discuss with your doctor. It's advisable that you have a nebulizer at home. Your doctor will tell you how to use it, the drugs to use, the dose to use, the frequency and all of that. Especially for children, it's very, very beneficial for them. Yes, so if you can afford a nebulizer, it's important to get one and have one, your personal nebulizer at home. It will reduce the number of visits you make to the hospital. Sometimes when you go to the hospital, all you will need is just to be nebulized. So if you have a nebulizer at home, it will save you the trip to the hospital with all the discomforts and all of that. So if you can afford a nebulizer, by all means get one, but discuss it with your doctor so that you will do it the right way.
If you like what you are hearing, kindly like, kindly share. You will be saving a life when you share this kind of videos. And please subscribe so that when next we talk about any health condition, you'll be one of the first people to know. If you have any questions for Dr. Uche, please just put it in the comment section and we'll get it right to her and she'll answer you. So today we'll be talking about asthma. We looked at what causes asthma, we looked at how to manage it, and we explained that one of the reasons why you have to use the inhaler is because asthma is something that affects the lungs. When you use your inhaler, the medicine is going straight to the lungs and not to your general system, which causes the side effects, which if you have asthma, you know the side effects you already have when you use the tablet.